Hi, I'm Dr. George Rappard. Welcome to Los Angeles Minimally Invasive Spine Institute's Spine Blog. A common question I get from patients is, my doctor recommended a fusion. Do I really need it? What are my alternatives? I tell patients that a fusion is a big procedure. In a lumbar fusion, the surgeon will remove the entire disc of the lumbar spine, replacing it with bone graft material and oftentimes a plastic spacer to hold the separation of the vertebral bodies. This has to be supported with screws and rods in the posterior spine because it takes about a year for bony fusion or bone healing to occur. It's generally a large procedure that requires quite a bit of rest and limitations of activity, and oftentimes there are alternatives. In some cases, back pain is caused by degeneration of the facet joints. These are the joints that hold the spine together in the back. When pain is caused by the facet joints, this could be treated by procedures of the facet joint. In other words, injections to anesthetize the joint, or procedures that are aimed at destroying the nerve that senses pain from the facet joints. That's called a rhizotomy. A fusion is not necessarily the answer. In some cases, pain is caused by the disc itself. When that occurs, physicians may perform procedures to remove the degenerated material in the disc, relieving the pain. Sometimes a fusion is absolutely necessary. Traditionally, a fusion would entail making a large incision in the back and cutting through the normal muscles of the back. The bone in the back of the spine, called the lamina, is removed. In addition, most or all of the facet joint is removed. Normal ligaments are then cut, and the surgeon enters the disc. The Los Angeles Minimally Invasive Spine Institute recently performed the first percutaneous endoscopically assisted fusion procedure in the state of California. In this procedure, our physicians placed a small tube through a natural opening in the spine and then using a special camera called an endoscope performed the fusion procedure in its entirety. The procedure was performed as an outpatient procedure and the patient went home within 24 hours. So, if your physician has told you that you need a spine fusion, be aware that it is a large procedure and there may be alternatives. These alternatives include pain management procedures, certain forms of minimally invasive discectomies, or, if absolutely necessary, a fusion which could be done in a percutaneous and minimally invasive fashion. Thanks for listening.